All right, so you didn't plan for it, but you got a concussion. Here's something to know. There's no mild, there's no moderate, there's no severe concussion, there's no grade 2 concussion. We don't do that. You had a concussion or you didn't, and now we have a phenotype or a flavor of concussion. You have a migraine type, an ocular type, a vestibular type, or whatever type. And there's reasons for that. So let's go through the autonomic physiologic reason, the blood flow reason for your symptoms. I'm Dr. Mark. I'm a concussion specialist. I have a complete concussion clinic, certified clinic here in Scottsdale. So the autonomic physiologic type concussion is going to be one where we're going to see a lot of like migrainous type headaches, migraine-like headaches with exertion or after exertion. We're going to see a hypersensitivity to various stimuli, so hypersensitivity to lights, to sounds, to crowds. We're going to have a general or cognitive fatigue, and the common triggers for these things are going to be a sustained mental or physical activity or an increased intensity in mental or physical activity because we're just being exposed to these stimuli. What might we see on the physical exam of someone with an autonomic physiologic symptom generator for their concussion? One of the things we might see is early exercise intolerance. So exercise intolerance before they reach or before you reach 70% of your heart rate max. Before that, we might even see orthostatic intolerance, meaning we see an intolerance to gravity. From laying down to standing up, we see abnormal changes in your heart rate or blood pressure. That would also indicate an autonomic physiologic issue. We also, just related to the concussion injury, might see transient visual or vestibular issues, which might be related to a different bucket, which I'll talk about in another video. Why do we think this autonomic physiologic symptom generator profile even manifests? Why do we think it happens? We think this autonomic physiologic aspect of it, this blood flow aspect of it, is due to just diffuse shaking and shearing of the whole brain and brainstem. And so more specifically, we might see this global sort of metabolic autonomic blood flow dysregulation. We might see cortical spreading depression, which is what we see in migraine, which is why we might get these migraine-like headaches. As imaging gets better, we might see sub-radiographic, so things we won't see on MRI or CT, but just sort of these more micro changes that are related to this blood flow issue. So how many of you or how many of your patients fit this profile? Let me know in the comments below.